COVID-19 update will begin in 2 minutes. Again, we will begin in 2 minutes. Good afternoon. Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe and Saskatchewan's Chief Medical Health Officer, Dr. Shahab. Premier Moe and Dr. Shahab will have some opening remarks, followed by time for questions.
Well, good afternoon, everyone, and thank you again for joining us here today on the advice and recommendation of Dr. Shahab and his team. Today, we are extending the current public health orders and guidelines for 4 additional weeks. Our new case numbers have been trending in the right direction. For that, we thank the people of Saskatchewan. Our 7-day average is now at 167 cases. That's down nearly 50% from the middle of January. There is reason for optimism, but it's not reason for us to let our guard down. What we are doing in Saskatchewan is working, and it continues to work, but we need to keep doing it to ensure this trend continues for the foreseeable future. That's why we've made the decision to extend the current guidelines for 4 additional weeks. And that's why we're asking everyone in Saskatchewan to keep following those guidelines as we have been. Physical distancing, wearing a mask when required, avoiding any unnecessary travel, and to avoid large gatherings and stay at home if you're feeling unwell or sick in any way. That's how you will continue to protect yourself as well as protect those around you. That's how we will continue to drive these case numbers down even further in the days ahead. Our vaccination program continues to move ahead as quickly as we are able, given the very limited supply of vaccines that we are receiving from the federal government. In places where they have done a large number of vaccinations, such as Israel or the UK, they are seeing some very positive impact on their case numbers as well as on their hospitalizations, particularly among elderly people who are at the highest risk of poor health outcomes should they contract COVID, and who are also in those jurisdictions receiving their vaccines first. So the vaccines are working. And we just need more of them, and we need more of them very quickly. As the Minister indicated last week, we are ready to go. We are ready to ramp up very quickly in Saskatchewan to 226 immunization clinics, covering about 181 communities across the province, and those are just the Saskatchewan Health Authority clinics. That does not include other locations such as physicians' offices, pharmacies, and any other community organizations that we may have the ability to partner with as we go through this vaccination effort. Of course, as of today, we have nowhere near the number of vaccines that we need to stock each of these locations. But over the next couple of weeks, we do expect to receive about 28,000 doses from Pfizer, as well as 4,500 doses from Moderna. These will be distributed to a number of locations throughout the province, and mostly to deliver second doses to people who have already received their first dose. However, we will finally be able to get a number of doses out to Swift Current in the southwestern part of our province, which has not received any vaccines to date, and that is a direct result of the reduction in deliveries that we have experienced over the course of the past few weeks. although these are still a very low number of doses. But the federal government assures us that deliveries will be ramping up significantly into March and into then the second quarter of this year. I can tell you it can't happen soon enough. Last week, after we announced that the Phase 2 sequencing of the vaccination plan would be primarily based on age, I said that our officials were having another look at including some additional categories of healthcare workers in Phase 1 of our vaccination plan, and that work has now been completed. We'll be moving about 11,000 additional, a little more than 11,000 additional healthcare workers right into Phase 1 of the plan. These include anyone that is directly involved in delivering COVID-19 immunizations in Phase 1 and throughout into Phase 2. This would include physicians, pharmacists, and other Saskatchewan Health Authority healthcare providers that are directly involved in delivering these immunizations, our immunization teams, if you will. Also included in Phase 1 will be anesthetists and other operating room staff, home care providers, and a number of other healthcare workers that are listed in the news release that went out earlier today. Our mass vaccination program is still going to roll out, primarily focused and primarily by age, starting with our elderly people first. We know that age is the #1 risk factor for serious outcomes from COVID, so vaccinating by age is the best way for us to reduce those very serious negative outcomes. This approach, as I said, is already working in places like the UK. In fact, a recent University of Oxford study showed that in the UK, COVID-related deaths in people over 80 are down 32%, while overall hospitalizations are down 60%. Age-based sequencing is the best way to vaccinate as many people as possible, and the best way to do that as quickly as possible. And in doing so, we can reduce severe outcomes as much as possible. We look forward to ramping up our vaccination program as soon as the federal government increases the delivery of our vaccines, as they have stated they will. And until then, just please keep following all of the good practices that are keeping each of us safe and keeping those around us safe. Thank you for what you are doing. Dr. Shahab?
Thank you, Premier. So I'll first of all start by expressing my condolences to the family and friends of the Saskatchewan residents, our Saskatchewan family who have passed away to COVID-19. And again, this is a reminder that everything we're doing, including now ramping up the immunization program, is first and foremost to reduce deaths and hospitalizations. Even though our case numbers are trending down, as the Premier said, it is just maybe our second week of numbers consistently below 200, and we really need to sustain this course. They're trending in the right direction, but we've seen how quickly they can reverse, not just in Saskatchewan, but in many other provinces, and not just due to COVID, the existing COVID strains, but also due to rapid introduction of variants of concern. So we really need to stay the course at the moment till March 19th, and then we'll reassess where our numbers are, how well the vaccine program is running, to see what needs to be advised, March 19th onwards. If we look at our, outbreaks, again, all the precautions that businesses are taking, all the precautions that long-term care facilities, personal care homes are taking, the health system is taking, is showing an impact. But wherever we have people in close proximity, despite all precautions, sometimes you can have outbreaks. So we have seen outbreaks in a variety of settings, long-term care facilities, hospitals, special care homes, and we really hope that once the vaccination program over the next few weeks is completed in these high-risk settings, we will definitely see a reduction in outbreaks and adverse events, including outcomes in these areas. I think that's our first goal, and we really look forward to achieving that over the next few weeks. And then, of course, while all of us wait our turn over the next months to get vaccinated, we need to stay the course in terms of, if you're going to a restaurant or bar, tables need to be 3 meters away, and there are some comments about people not understanding the rules. That's not acceptable. They've been there now for more than 6 to 8 weeks. 3 meters is a huge distance if you think about it, and there, you can safely go to a restaurant with a group of 4 people. You may be at some risk at that group of 4, but you minimize the risk to others. So really there should not be large outbreaks happening in those settings as long as businesses and customers are complying with those outbreaks. Similarly, we've seen that even with all the layers in place, sometimes we have seen outbreaks in workplaces up to 17 over the last 2 weeks. And again, despite our best intentions, sometimes transmission can happen just because, maybe there's an opportunity that we didn't think of. But often it's, when we're, a bit relaxed with our colleagues, we may be sitting closer together over break time, maybe sharing food or other items, and during that interaction, which is very human, transmission does happen. So till such time as all of us can get vaccinated, we really need to follow these fairly simple precautions, physical distancing, mask use, hand hygiene, staying home if you're sick. This has always worked for us. It's worked for us again, and it's really important to keep our numbers low so that vaccination clinics, as they start ramping up, they can happen in a smooth manner. Healthcare workers can give vaccinations instead of having to look after patients in hospital. Healthcare workers can give vaccinations instead of having to do contact tracing. But testing has to continue at the same time. Testing is essential to keep an eye on where the pandemic is. So again, our testing numbers are not too bad, but they have been trending down. And it's really important to make sure that we seek testing if we have symptoms, if we have any concerns, because that will really make sure that we are able to, stay home if we have COVID for 10 days, or if we have close contacts, they also stay home, and that will continue to break the chains of transmission. So finally, I'll just say that, the weather is improving once again, so lots of opportunities to be outdoors as we end the school break this weekend. But again, even when you're outdoors, you can be in up to groups of 10. Keep your physical distance. Do not share food or other items between households. And for other settings, again, do beware of the Reopen Saskatchewan guidelines. If you're shopping, use curbside pickup when you can. Go when it's less crowded in retail areas, and we really need to now, people who are 50 and older, people who have underlying risk factors, we really need to protect our friends and family who are older and who have risk factors. They've been doing a great job shielding themselves, utilizing all these amenities, curbside pickup, other measures to minimize their exposure, and we as friends and family need to protect those who are most vulnerable for the next few weeks and months till 50 and older have gotten vaccinated, and then ultimately all of us over the summer have gotten vaccinated. Because again, I think this is the light at the end of the tunnel, but we do have to stay the course for the next 4 weeks with the current public health measures in place, and of course we'll continue to reevaluate how those can be changed as we go forward. Thank you.
Thank you, Premier Moe and Dr. Shahab. We'll now take questions, and we'll start in the room. Arthur?
This is for, I believe, the Premier, but perhaps Dr. Shahab may have some thoughts as well. I just wanted to know, today I believe it was first reported NACI is recommending that people who are racialized should be prioritized in some way within the vaccine sequencing. And I wanted to know whether you've given that any consideration, whether you've reviewed the vaccine plan in light of that, and why or why not?
Well, we've first of all, we have our vaccine plan that was put forward last week is focused on age. Age is the number one criteria for negative outcomes when you do contract COVID. With respect to the risk of contracting COVID, which is, a number of organizations as well have put forward their organization that they should be having some priority in some way in advocating for to be earlier in the phases of the vaccine rollout. And I understand why. I understand why many organizations, we had the police association, for example, advocating on behalf of its members, and I understand why they would be doing that. But we are focused on reducing the negative outcomes once an individual does contract COVID, because of what we see happening in other areas of the world, because we know it will be effective in driving down our hospitalization rates, driving down our ultimately our fatalities here in the province. We did, however, have some priority in phase 1 in our northern rural and remote communities, which are predominantly Indigenous in their population. In where other Saskatchewan communities in phase 1, where we had long-term care residents and staff, number of healthcare staff, and now in phase 1 we'll have over half of our healthcare staff will be prioritized. But we also had in most Saskatchewan locations individuals that are 70 and older would be priority of phase 1. In our northern rural and remote locations, communities, that was 50 and over. So there was some priority given for a number of reasons in our rural and remote northern locations across the province, and that remains today, as there was still vaccines being delivered. I can't remember in which community, but yesterday the vaccines that were delivered were in one of our northern communities as well. So, having relooked at the plan that we have put forward is a solid plan that does address the risk of negative outcomes, and I think it balances that with the risk of transmission in many areas of the province. Do you have anything to add to that, Doctor?
Yeah, so I'll maybe just, so the framework that NACI has obviously is very good, and it kind of lays out the whole plan. It's not really sensitive to vaccine supply, and it assumes high level of supply, like, for example, the UK has shown right from the beginning. But even there, you have to start somewhere, and even in countries with high supply like Israel and UK, they had to start with, the first group was where you actually operationalize the vaccination, you go for highest risk of adverse outcomes, hospitalization and death. So what we've seen in many other jurisdictions and what we are enacting here is, the risk of death is highest based on age. And so that has to be number one principle. And then, of course, the second category is risk of transmission to those who are at high risk, people who, so staff in long-term care facilities. Healthcare workers obviously are at risk of exposure, but also risk of transmitting to people who may be immune suppressed or may also be at high risk. So again, people who are receiving cancer care, who may be in ICU for COVID or for other reasons. So again, that's the other category where we need to protect people who may themselves be at risk of exposure, such as healthcare, but also at risk of transmitting to those at high risk. So that again is being sequenced in at the same time concurrently with those at highest risk based on age. But then, of course, we have to recognize that, in addition to healthcare, we have a large number of people who've been working from day one, in grocery stores, in law enforcement, in transport and trucking. And obviously, we need to recognize their sacrifice. They have stepped forward when many of us were able to step back and work from home. But the supply currently does not allow for them to be prioritized. But obviously, as the vaccine supplies pick up over March, April, May, obviously, essential workers have played a tremendous role. And as they are sequenced by age, it's going to be important. But anything that we can do to, prioritize them as they become eligible based on age, I think is going to be essential. They may be at lower risk of transmitting to people at high risk, but certainly they have been in the front lines with risk of exposure. And until such time comes, I think that's essential why all of us have to practice all these measures. Like even if we see hospitalization deaths going down over the next few weeks, we can't let our guard down because we can't risk our essential workers getting exposed to COVID by us letting our guard down till we really have made vaccine available to everyone. So I think that is a really important perspective. And then secondly, I'd just like to say that, obviously, for those of us who have a family physician, if you develop COVID, stay in touch with your family physician. Public health does follow up till you're not infectious, which is usually 10 days. But that linkage with primary care, with the health line, with your family physician is important, so that even if you're at home, if you are not doing well, you can then be quickly, your care can be escalated for hospital care. And I think that's worked very well with that relationship is there. And as we've seen, even though Canada has a universal health system, everyone's access to a family physician or primary care may not be uniform. But in Saskatchewan, again, it's important for all of us to know, what is our care pathway? If we get COVID, how will we isolate? Who will check in on us? Is it a family member? Is it a friend? That's really important. If we can't isolate safely at home, to have that discussion with public health, what's a safer way to isolate, and then make sure that we understand the care plan with the health line, with the family physician, with primary care, so that if we start deteriorating if we're not doing well, there's a quick escalation for the second level of care, because that's also essential. And I think in the context of racialized populations, there's a high risk exposure, but there may be some delays in seeking appropriate care. So not so much in Saskatchewan, but I think it's a good reminder for all of us to have a care plan. Who's going to check in on us from friends and family, and how will we stay connected with our family physician, or if we don't have a family physician, through Healthline with primary care.
Follow-up, Arthur?
This should be for the Premier. During the last press conference, I do believe you said that you were not taking it off the table, the idea of separately seeking our own vaccine supplies, in much the same way Manitoba has attempted to do. And I just want to know if you have any updates and whether any discussions are currently taking place in that.
I believe I do have a call scheduled on that topic. I'm not sure when it is, but in the very near future. But in saying that, my understanding is that these vaccines would arrive post-September. If we take the federal government at their word, there will be vaccines available for all Canadians by the end of September. We've already made a significant investment in vaccine research and production alongside the federal government and Vito Intervac, and continue to advocate for Vito Intervac to become the center for pandemic research in Canada, as they have the ability to ensure domestic vaccine development and production right here in Saskatoon, Saskatchewan, for Canadians into the future for this COVID virus that we are facing today, as well as any future variants, as well as any other pandemics that we may face. They're well positioned to lead the Center for Pandemic Research here in Saskatchewan. So we're proud of the investment that we had made. I am growing in my confidence that, I feel that we are going to have, after talking with the CEO of Pfizer, that we are going to have access to a large number of vaccines by September, and that we will ensure in this province that we have every opportunity to provide access to those vaccines in Saskatchewan, moving forward with our over 200 SHA clinics in 181 communities. We are going to be able to provide this vaccine in a very rapid turnaround time upon receiving it. That being said, we haven't received enough yet, and we most certainly are looking for some higher numbers as we get into March. And I'll go through those numbers in a little bit, a subsequent question, I'm sure. Just back to your first question for a moment as well, Arthur. We see the federal government is prioritizing the territories. I think they're hiving off part of the next Moderna shipment to provide to the territories, so that there will be 75% of the territory's population will have access to a vaccine here in very short order. That's coming at there's consequences to that decision as well. We've heard the southwest of Saskatchewan, Swift Current and surrounding area has not yet had access to their first dose of vaccine, in part due to supply challenges that we have had, where we have had to use incoming vaccine for second doses. But also hiving off and providing these Moderna vaccines out of the next shipment to the territories is going to result in lower numbers of Moderna vaccines coming to Saskatchewan. And one of the consequences is we are actually going to be short about 1,000 doses for our second dose for about 1,000 people here in the province. So we're not quite sure how we're going to navigate that within the time frames that we have to provide these doses. But when you do, and this gets back to the conversation we had last week, when you do prioritize specific groups outside of the age-based categories, there are consequences, and it does ultimately make for a more challenging vaccination environment. And so, I just wanted to point that out, that there's already challenges from some of the priority allocations that the federal government has done already.
We'll take our next question from the line. Operator?
We have Lisa Schick with CJME.
Hi. I'm just hoping you might be able to explain a little bit more the decision on adding more healthcare workers to phase one. What changed, or what went into this decision to include them now that didn't go into the original decision to exclude them?
I'll make a couple of short comments, and then Dr. Shahab would likely have something to add. But what you see with a number of the disciplines that are here are they are either have a high propensity for coming in contact with COVID patients, or are part of our vaccination teams, or are parts of our healthcare system that we most certainly want to continue to have operation throughout, as we have for the last while. They could also, to Dr. Shahab's point, may be individuals that come in contact with someone else that might be at very high risk. But a lot of what you see here, as far as the numbers, are people that are choosing to come forward and be part of our vaccination teams across the province. That being said, if there's pharmacists or physicians that are choosing not to be part of the vaccination teams, we would ask that they not go get their vaccine in a priority basis. What we want to preserve these priority vaccinations for, and these very scarce vaccine resources that we have, are for people that are actually participating in the vaccination rollout here in the province. It is going to be an all hands on deck, and we're asking all to participate, and we want to ensure that they're protected as they do. So nothing changed. We did say last week that we would be reviewing the about 16,000 healthcare workers that were originally allocated to go into phase 1. This adds about 11.5. This brings us up to about 26,500 healthcare workers that would be prioritized in phase 1. That's about 60% of our healthcare workforce that are prioritized in phase 1, and this still does preserve, as I said earlier, our ability to have mass vaccination capacity and to really turn these vaccines around when we receive them in higher numbers, to turn them around, make them available to Saskatchewan people as quickly as possible. But anything to add, Doctor?
Yeah, and I'll say that all of this will be under constant review based on vaccine supply, vaccine uptake, and epidemiology. Because again, if we look at our hospitalization numbers and ICU numbers, I think we are all relieved that not only are our daily case numbers trending down, our test positives trending down, our hospitalization ICU numbers are also trending down. And we have to recognize that we were in a situation where if they had trended up and if there were outbreaks in healthcare settings, then you have a larger number of healthcare workers who are not working because of COVID or because they've been close contacts, even though they were using PPE. And then, additional healthcare workers have been trained to, support acute care, to continue primary care. We discussed just earlier that primary care is so important so that the vast majority who are isolating at home recover successfully at home, but if required, can access a high level of care. And similarly, healthcare workers in different disciplines will be coming to assist in the vaccination effort and have been involved in contact tracing and supporting testing sites. So from all this perspective, I think, getting more healthcare workers vaccinated protects all these critical areas of healthcare, but it has to be done in a phased way. It has to be proportionate to also making sure that long-term care residents, personal care home residents, people 18 and over are also done right now, and then as vaccine supplies pick up, 70 and older, and then later 60 and older. So I think all these things are happening concurrently. They're constantly being reviewed based on supply, not just total supplies coming to Saskatchewan, but then how they are distributed to different parts of the province, and also the epidemiology in terms of ultimately we want vaccine in every corner of Saskatchewan, but initially it did go to areas with higher case numbers. Thank you.
Follow up, Lisa?
Yes. So 11,000 more healthcare workers in phase 1. That's 22,000 more doses. Does that mean anything for when the start date will be for phase 2? Is that going to push things back at all?
I would. That brings us up to we're expecting about 380,000 doses in phase 1. This would bring us up into that neighborhood of about 400,000 doses. If we continue to receive vaccines at the rate that we have been, and we have about 50,000 doses administered thus far, yeah, that would delay it weeks. When we get to the end of March, early April, when we're expecting much higher volumes of deliveries, and we're delivering likely, 6,000, 7,000, 8,000 doses per day in the province, we would think that the delay would be minimal for those additional doses, and most certainly the benefit in our healthcare sector and protecting our healthcare sector would be substantial. But anything to add to that, Doctor?
Yeah, I think a couple of things. Initially when we were doing our pilot, we were very keen to get the second dose in right on time. For long-term care residents, obviously, the high risk second dose right on time is important. Then we were able to extend the second dose up to 42 days. Certainly, data from other countries showing that the second dose within 42 days is fine, but if it's extended by a bit, it does not have a negative impact. A first dose does really well after 2 to 3 weeks in getting that high protection, and a second dose at some point, ideally within 42 days, but if it's a bit outside that, I think is fine. So from that perspective, while it's important to complete the second dose for everyone in phase 1, as the supplies pick up, you can at the same time start people in phase 2, because I think you have that bit of overlap that people in phase 1 are completing the second doses and people in phase 2 are then starting. It was very challenging in February because of limited supply, but as the supply picks up, that concurrent approach will be possible. Thank you.
We'll take our next question in the room. Mark?
Premier Moe, what's your reaction to the federal government's proposed legislation to allow municipalities to ban handguns, and will the province be doing anything in response?
Well, I would say that we already have. We passed legislation this last session that really makes that portion of the announcement that the federal government made today with respect to municipalities enacting bans on how handguns are moved around, or any type of municipal legislation with respect to handguns isn't available to Saskatchewan municipalities, and we passed that legislation last session. I think the broader concern that we would have with the gun legislation that is being moved on is a lack of consultation with provincial governments across Saskatchewan. In fact, I think our consultation has ultimately total amounted to a phone call after the legislation was introduced publicly. That's the degree of consultation that our province, at least Saskatchewan, has had. So we've had to be fairly proactive in our efforts, passing legislation last session that would prevent this patchwork of different municipal laws in different communities across Saskatchewan. There is one set of firearms regulations in the province that is interpreted by a provincially appointed chief firearms officer, of which we had to proactively put in place as well, understanding this is the federal government's jurisdiction, but the laws will be interpreted by a provincial appointee and the chief firearms officer here in Saskatchewan. Had we been consulted, I think we would have quickly indicated to the federal government that it isn't law-abiding firearms owners that are the problem when it comes to crime rates using firearms. And most certainly is firearms that are acquired by a different way, either smuggled, and I think they're addressing that here today, but also stolen. There's stolen firearms that are responsible for many of the challenges that we have with firearms-related offenses here in Saskatchewan, and I think there's an opportunity for the federal government to increase their attention to dealing with property crimes that involve the theft of a firearm.
Do you have a follow-up, Mark?
On another topic again, regarding the control tower at the Regina International Airport, you signed a letter to with other premiers to the Prime Minister today. What are you asking the Prime Minister to do, and why is it important for the province to keep control of the control tower at the airport?
Yeah, we signed a letter with premiers, very much mirrored the letter that was sent by the mayors of the affected communities, but with the premiers of Yukon, British Columbia, Alberta, myself from Saskatchewan, Ontario, and Quebec, all representing communities that could potentially lose their control tower, air traffic control towers operations, and the people working within. Now, we understand that NAV Canada is a private organization that is operating these towers, but we also understand that the minister holds the card on whether these stay open or not. And so what we've asked the Prime Minister to do is to speak to his minister, understanding that this is during a global pandemic, when air traffic is severely diminished and depleted with respect to the number of flights coming not only into Regina but anywhere in the world. This is no time to make a decision like this. the tower and the airport, a fully functioning airport here, whether it be in Regina or Saskatoon or anywhere else in Saskatchewan, is absolutely critical to the economic recovery that we are looking for post COVID-19. And we will advocate with the Prime Minister through this letter, as well as a number of us premiers will be advocating with the Prime Minister at the next opportunity with the phone call the First Minister's call that we have, and I believe we likely will be having one this week. That this is just not the time to be doing this. They should delay this decision at least for the next number of years, and ultimately, we would continue to advocate for the full functioning of the Regina Airport, not only due to the due to the opportunity for use on a personal basis from not only people from Regina, but people from the southern portion of the province, but also for, as I said, the economic opportunities that opens up to our province and to the city of Regina. So credit to Mayor Masters, who raised this with me very quickly. She'd reached out to her counterparts in impacted cities across the nation, and had asked me what the province could do. I had talked to my provincial counterparts, premiers that were also representing impacted cities, and we have wrote a letter here today, and that's the start of our advocacy for the federal government to delay what we think would be a very wrong decision at the wrong time.
We'll take our next question on the line. Operator.
We have Caitlin Wilson with Global.
Hi. At least one First Nation in Saskatchewan is struggling with vaccine hesitancy. The chief estimates 1 in 4 people being offered the shot are refusing it, and he's linking this with the history of racism in the healthcare and continued trust issues. Is this rate of refusal higher than it is in other groups being offered vaccines early on?
Yeah, thank you. So, vaccine hesitancy, or its more positive counterpart, vaccine confidence, is essential for all vaccine programs, and we've addressed this throughout the years with all vaccines that have saved countless lives, and COVID is no different. And actually, that was one reason why like the Premier mentioned at the last media wheel, healthcare workers stepped up right in the beginning, not just because they were working at the front lines, but because by demonstrating that this is a safe and effective vaccine, they were demonstrating by example that we should all consider getting the vaccine when our turn comes. So that's number one. Number two is obviously any concerns about vaccine safety should be discussed with public health. There's credible information that's available, and obviously whenever there's any concern with vaccine programs, I think we need to be very transparent about vaccine safety and effectiveness, and then address any questions. And I know that in the example you cited, that our colleagues in Indigenous Services are working closely with First Nation leaders in answering those questions, and the same questions can come up in any population, any age group, and I think we need to listen carefully to what the questions are and continue to provide as much information as we can. And we've seen this come up with other vaccines that have come into programs in the past, and over time there's been high acceptance of vaccines, and that is critical actually to see the positive outcomes at a population level. Obviously at a clinical level, the COVID vaccine is very safe and very effective, but we need a high uptake at a population level over the next few months to see its impact at a population level as well. But certainly those are important areas that I think we all need to pay attention to and answer questions and concerns both at local community level, but also provincially and nationally.
Do you have a follow-up, Caitlin?
Yes. And how does the province providing primary health care in Saskatchewan work through ongoing issues related to racism and health care and the fallout, for instance, like seniors living on reserves refusing the vaccine?
Well, I would say, first and foremost, the Saskatchewan Health Authority is specific to our Indigenous communities, and maybe specific to the incident that you raised in your first question, is there to support the Indigenous healthcare teams that are delivering the vaccines in our First Nations communities. And if there's information that is required, that request will be made either at the health delivery team's level, or it can be made at the chief's level as well. If the chief would request further information on the safety and effectiveness of vaccines, up to and including some of the statistics that I had brought forward from what's happening in other countries where the vaccine programs are far ahead of where Canada and Saskatchewan's is. We can provide that information and hope that the vaccination team and the chief and council would disseminate that information to the people that ultimately that they represent. I don't know that we've seen a large refusal of vaccines, although it's a voluntary decision for each of us to make, and if people do not choose to take the vaccine, that's their prerogative. But the vaccine, ultimately the vaccines to date have been just so sparse that there's been more than enough people that have stepped forward, including, and the first vaccines being administered in the province were to our frontline healthcare workers. So as I said, the vaccine and whether or not you choose to take it, and we would encourage you to, it is voluntary. No one's going to force people to ultimately put themselves forward to be vaccinated. But in saying that, we strongly encourage everyone to at least consider it and to take the vaccine. It's ultimately our path back to a more normal Saskatchewan. Vaccines have been successful in a long list of viruses, diseases over the years in saving families and saving lives. And it ultimately is access to large number of vaccines and mass vaccination of the people in the province is ultimately how we're going to keep everyone safe in Saskatchewan. So we strongly encourage everyone to consider taking the vaccine, but it is voluntary. But we will provide information on request. And in advance, you'll see an advertising or a information campaign coming as we get into the mass vaccination schedules and phases that we have. This is ultimately our opportunity to back to a much more normal life with with keeping our family members safe.
We'll take our next question in the room. Steph?
Mr. Premier, are you saying Ottawa is incorrect in its decision to divert some of the Moderna doses from Saskatchewan, as you say, to the territories? And is the province being compensated in any ways? Like maybe we're getting less Moderna, but we're going to get more Pfizer instead?
And no, thus far we've gotten less of everything. I believe we're maybe about 65 to 75% of what we've expected to receive by the end of February is what we're actually going to receive. Now, I'm not saying whether they're correct or incorrect. What I'm saying is there's consequences. We're going to have 1,000 people, and we're not sure how we're going to navigate this at this point in time. But we'll have 1,000 people that it appears that we will be short of having access to their Moderna second doses. And so, maybe there's 1,000 people that won't show up for their second dose. I don't know at this point in time. But as Dr. Shahab had said, this may be one of those cases where we're going to have to extend a little bit beyond the 40-some day limit that we have, due to the fact that we just haven't been able to procure the appropriate number of specific Moderna doses that we need to provide people with their second dose.
Yeah, and I'd just like to maybe emphasize that if for whatever reason, so two things, if for whatever reason you can't get your second dose within 42 days, it's fine to get it whenever it's available. So there's no issue with that. There's increasing evidence that shows that extended interval is not harmful. And in fact, in the UK, they routinely are giving all vaccines at 3 months, the second dose. So that's point number one. And point number two, I also wanted to maybe just on the vaccine hesitancy question say that, while most people are getting the vaccine when it's offered, if for some reason you haven't made up your mind, you don't lose your position in line. You're once eligible, you're always eligible. So it may not come to your community again right away, but again, it will be coming in successive waves over the next few weeks or months. So it is important that if for whatever reason you're not able to get it at that time, even though you're eligible, you can think about it, ask questions from public health, from your physician, from other friends who've received the vaccine, and then hopefully most people will choose to get it, if not at the first offer, which many people are choosing to get it, but the second time around the vaccine comes.
Follow-up?
Yeah, again to the Premier, when vaccines are so scarce and the delivery schedule is changing and has not been as much as everyone hopes it has been, why would you be sending such a scarce commodity to a region of the province like the Southwest that has 2 active cases, which in terms of regions must be one of the lowest in Canada, or probably is? So why send such a scarce resource there? Because it doesn't seem the need is necessarily as high in other parts of the province.
We've been to a number of other parts of the province to vaccinate our long-term care residents and their staff. In fact, we have about 50% of our long-term care residents and staff have had their first dose, and we have about 20% that have had their second dose. And we do have a number of long-term care residents and staff and facilities throughout the Southwest, and so we want to make sure that we are prioritizing within phase 1 those residents that are elderly and are at highest risk of negative outcomes when it comes to contracting COVID-19. You're right, our numbers are fairly low in that area now, which is why we have prioritized some of the higher risk areas of the province in their first 50,000 doses that we have received. But in saying that, if you go back just a number of months, the Southwest was an area that had a fairly high concentration of COVID. So things change throughout Saskatchewan, and they change quite quickly. We've seen outbreaks in healthcare communities. We've seen outbreaks in communities from corner to corner, including in northern Saskatchewan to the very southern portions of Saskatchewan throughout the last 11 months. So we are on our priority basis providing vaccines to that phase 1 complement, and it begins with our long-term care residents, of which we have many in the Southwest. And so we unfortunately don't have the opportunity, due to the variable delivery schedules that we've been working around, to send a large number of doses into that area, as we are, as I said, preserving a number of the doses and allocating those for second doses in other areas of the province, people that have already had their first dose. But with to whatever degree we can, we are providing some of those doses into an area of the province that has not yet received any opportunity for vaccinations. And we see other areas of Canada that are approaching access to 75% of their population. So we most certainly are making the best of the very variable vaccination schedule that we have been facing. In saying that, I think better times are ahead. I think we are going to see the numbers of vaccines coming into Saskatchewan increase in the days ahead. It's going to make for some busy times. As I said, now our phase 1 delivery will be up to about 400,000 doses to treat to vaccinate about 200,000 people, with the addition of the healthcare workers here today. We've done about 50,000 so far, so just over 10%. We're expecting to get that up to about 80,000 by the end of February, and we are at 107% of our vaccines received have been delivered, which leads the nation. By the end of March, we're expecting about 190,000 doses, so that will get us close to about halfway through our phase 1 delivery, and then ultimately be into April, where we are hoping to get into that 5,000 plus per day vaccines, and that's what we will hopefully get some clarity on from the Prime Minister later this week, or whenever we talk next.
We'll take another question in the room. Adam?
I have a question about variants and whether we're going to ramp up our variant testing or the sequencing that we can do. Where are we at on getting that done in province? I know there was an effort to get that going. And given what's happening in Newfoundland, the fact that they found the variants there, they've decided to go to sort of a shutdown, and Manitoba's closed the borders a little bit as far as the isolation order. Where are we at on first testing for the variants here, and how concerned are you about what's maybe being seen elsewhere in the world and in Canada?
Yeah, so certainly, the Royal Romanov Provincial Lab, Dr. Jessica Minion, she's fully aware of the need to sequence as high as 10%, and so they're looking at bringing testing in-house as well, and right now the samples are going to the National Microbiology Laboratory in Winnipeg, and there's a very structured way in which samples are selected, so obviously all cases linked to travel, outbreaks, people under the 50 who are hospitalized, and then there's sampling that's done on a geographical basis. So all those tools are used. Obviously, no jurisdiction can sample 100%, but some countries are sampling up to 25% or more, like in Europe. But at this point, nationally, I think there's a desire to sample at least 6%, which we are attempting to do right now, but then with in-house capacity go to 10%. In terms of concern, obviously, there is a concern because the UK studies have shown that the variants of concern are transmissible by about 60 to 70%. So existing public health measures, if they're sufficient to bring your case numbers down, they don't work for variants of concern, and so you have to tighten them up even more. So obviously that's the challenge. So even though they may not be more lethal right now, the B117, for example, the UK, it may not be more lethal, but because it infects more people, 70% more people, even if the proportionate by age who require hospitalization is the same, if you have more people ill, that number rises, and that's what the UK saw in the third wave, right after they'd come out of a lockdown. So hopefully in the UK now, they've seen the positive impact of vaccination. They're close to getting a large proportion of their population 16 over vaccinated, so they're seeing the positive impact, and that same in Israel. And I think that's why it's essential that even though our numbers are trending down, we remain very cautious. We keep the numbers low till our vaccination program has had the opportunity to especially protect the most vulnerable, 60 plus and then 50 plus. That's going to be essential. And then in terms of, minimizing the risk of importation, we really should not be doing any non-essential, not just international travel, but interprovincial travel. And if we are traveling, we need to be very conscious of what we're doing, how do we minimize getting exposed to COVID and minimize bringing it home. I highly recommend if you come home after even interprovincial travel, monitor yourself closely, stay as much as possible to yourself, your home, or if you're working in a business, be very conscious for the first 2 weeks, seek testing immediately. And I think all those steps are going to be essential to minimize the risk of importation. But you're absolutely right. All 10 provinces now are reporting variants of concern, and when they come, they spread very quickly. Thankfully, in our situation, the 2 instances were all travel-related. One travel-related case and a secondary household contact, and then another travel-related case. We've seen no further transmission, but I think we need to be extremely vigilant, especially till our vaccination program has had a chance to really protect, the most vulnerable first, and then over time, all of us.
I would just say on the vaccines and their effectiveness on all of the variants, for the most part, looks fairly positive. And the conversation I had with the CEO of Pfizer the other day was fairly positive on the effectiveness of at least the Pfizer vaccine on most, if not all, of the variants available. The provincial lab currently is working through the licensing process for to be able to test the variants here in province, which would allow us then to go from 6% to 10% of our testing rate. And so we'll update you on as soon as that process is complete. But that's where it is right now.
Follow up?
How are we balancing some of the mental health issues of people now being these restrictions extended for another month? Will be about 3 months by the time these are done. There's people that aren't allowed to have someone else in their household that were maybe hoping for being able to have someone visit with a mask. I know it's tough for us to police that, but what do you say to those people that are wanting to see a grandparent or parent, or have their grandparents see their grandkids, or just someone who lives at home, lives alone, who's not able to have a small bubble because we're going to be now through this for another month or so?
Yeah, sorry, go ahead, Doctor.
Well, I say that, first of all, if you are on your own, you are able to link with one household. So I think that exception is there. And for caregiving purposes, for child care, elder care, that exemption is still there. But we have seen that, like we were talking about restaurants, the tables have to be 3 meters apart. And if I was walking around with the tape measure open at 3 meters, and I was moving around my house. I couldn't figure out how I could get another family, sitting 3 meters away. And so I think, the reality is that we see transmission in households very quickly, and that can, negate all the ground we've covered. that can very quickly negate that. We did see over the holidays it was hard that families couldn't get together in the traditional way over the holidays or Christmas, but there were people were outside, they were meeting and greeting outside, and that didn't lead to as much transmission as if these regulations hadn't been in effect. So it is hard, but I've heard also that many people who are shielding themselves, they're actually thankful for these restrictions because they feel that otherwise they can't say to their close and friends and family not to visit. So I think people who are 50 and older with comorbidities are actually wanting to shield themselves, stay safe till they get the vaccine. And I think we need to do, irrespective of the public health orders which currently remain in place, we need to do everything we can to stay in touch virtually, meet and greet at a distance, but make sure we shield the people who are most vulnerable till they're vaccinated. And it is hard, but I think, we've always said maintain your physical distance, but stay connected, by keeping your physical distance outdoors, virtually. There's so many ways to check in on each other, and we need to continue doing that, being connected socially by whatever means we can, but, shielding people who are at high risk. For the next few weeks still, everyone who is at high risk especially has had a chance to get vaccinated.
I would just say, as we have introduced measures over the course of the last number of months, but up to and including, I believe it was December the 12th, where we put a number of significant measures in, there was a lot of back and forth on how do we control the spread of COVID-19 and still provide those very opportunities for families to visit and to not lose touch with one another. Because there are impacts, as you have pointed out, Adam. There are impacts to further measures, in particular if they need to be in place for a number of months. For example, when it came to youth recreation, we had some challenges with some outbreaks in a number of youth recreation settings. However, there is a very large benefit, I think, to the youth in particular, for the opportunity to get out and play some basketball, to play lacrosse, to skate on an ice surface. However, we aren't able to bring large groups and different groups of them together. And so there's an example of how we were able to still provide the opportunity for youth to, play the sports that they love, and to participate in the things that we know they love to do and are healthy for them, both physically and healthy with respect to their mental health. But by still being able to control the spread of COVID-19 in those environments. Is it perfect? No, it isn't perfect, and I hear about it often from family, friends, and from others across the province. But when you look across the nation at where many provinces have been forced to go to with respect to youth recreation, we've been fortunate in Saskatchewan, and we've been fortunate because of the great effort that Saskatchewan people have made. So we have had, yes, opportunities to gather in small groups and get opportunities for our youth to attend school, to participate in different recreation opportunities, and have a haircut, which hasn't always been an opportunity in other areas of the nation as well. So what would I say to people as we extend these measures for another 4 weeks is we're in the final stretch. And I would say that there is some hope on the way. I've spoken often to the opportunity to potentially expand our household gatherings, our household bubbles at some point in time. I don't think we're quite there yet today. But that may be one, if we can continue on this trend of reduced numbers, reduced hospitalizations, and ultimately reduced fatalities in the days ahead. That might be one that Dr. Shahab may be able to look at on, previous to the 4 weeks going into, up to and including March the 19th. So we're in the final stretch. The vaccines are going to ramp up here in later March. We're going to see what I hope will be very different numbers of deliveries. They should know that their provincial health authority is ready to deliver those vaccines and to make them available. And I think things are going to happen quite quickly in the months ahead. Most certainly when you compare it to how quickly things have happened over the course of the last 11 months. So we see the light at the end of the tunnel. we need to stick this out just a little bit longer with the variants that are here and and keep our numbers trending down as we head for the finish line. And I just once again thank Saskatchewan people for everything that they have done up to and including today. They have responded in the way that I expected and in a remarkable fashion.
We'll take our final question on the line, operator.
We have Josh Ryan with Battlefords Now.
Thank you. One of the things we've seen in the last couple of weeks is more talk around vitamin D use for COVID-19 patients once they're in hospital. There have been a couple of studies, including one from the UK, that have shown as high as 80% reduction in ICU visits, as well as 60% reduction in deaths for patients once they've already contracted the virus. Is this something that the province is thinking about possibly implementing in their own hospitals?
So I'll have to ask with our clinical colleagues about are they doing any trials, including vitamin D, but we'll have to get back on that.
Do you have a follow-up?
No, that's it. Thank you very much.
That concludes today's update. Thank you for joining us.
Thank you.